Welcome, Sovereign colleagues. My name is Ashley Jordan. I am the Program Director of Clinical Operations for our Palm Desert region, and I am honored and equally excited to present to each of you the basic overview on the evidence-based model that successfully converges multiple treatment philosophies known as seeking safety. My goal as your presenter is not only to provide you with a general understanding of seeking safety, but to get you excited about its many benefits. This curriculum cuts through the traditional belief and philosophy often used within the addiction treatment industry that states you can't deal with the trauma until you get that addiction under control. Seeking safety does not prescribe to that belief. So uniquely, it considers and treats them in a powerful duality. So without further ado, I will introduce to you the basics of this treatment approach. Please consider this quote as we move forward. And so, as citizens both locally and globally, we face the same process as we do in relationship with our loved ones, office mates, and friends, discovering how to live in the balance between admitting on some level that we are powerless, while at the same time, and through that process, finding the power we do have to make real, powerful, and lasting change. Welcome to Seeking Safety. At this point, you may be asking yourself, what is seeking safety and is it effective? Seeking safety is an evidence-based treatment approach. So before I proceed with the rest of the bullets, I should add that this model has been endorsed by the Psychotherapy Division of the American Psychological Association and Society of Addiction Psychology. Seeking safety has been listed as level A research. For those who may not be already aware of what level A research would mean, this is the highest level one could hope to achieve in the evidence-based research world. Additionally, seeking safety approaches therapy from the present focus counseling model, and it is able to be used for both men and women, adults and adolescents, to acquire safety from substance abuse and or trauma, thus the name Seeking Safety. It can actually be conducted in any group size, small, medium, large, you name it, and within individual modality. You're not restricted to do one or the other. Seeking Safety also does not require patients to focus on the trauma. So if a patient does not feel that they are ready to provide detailed accounts of their traumatic experiences, they wouldn't be required to, and it doesn't stop progress. So while training is not mandatory for facilitators, clinicians, and therapists, it is encouraged and many options are made readily available. Within Seeking Safety, you have 25 topics. That's a lot to choose from, which is great, because each address and introduce a different coping skill and can be conducted in any order. Seeking Safety has the flexibility to be used within any length of treatment and any level of care. Inpatient, residential, outpatient, you name it. The flexibility is available. This can also be used for any type of substance and any type of trauma. There is absolutely zero requirement to meet any kind of formal criteria or have a PTSD or substance abuse diagnosis. Seeking Safety has also been utilized with vulnerable populations, diverse populations, such as the severely mentally ill, veterans and active duty military, homeless, the domestic violence, and offender populations. Now that we have a general overview of Seeking Safety and its many benefits, it's easy to understand why we use this here at Sovereign. Furthermore, it has been described by treatmentinnovations.org as being the only model to outperform controls in randomized and or controlled end-of-treatment trials. I'd have to say this is pretty impressive, isn't it? Are you excited yet? As many of you are aware, trauma and substance addiction share comorbidity, and there is a great industry misconception. On that note, allow me to share with you a quote by Dr. Lisa Nahavitz. Dr. Nahavitz is a professor of psychiatry at the Boston University School of Medicine and lecturer for Harvard Medical School. She currently works as a research psychologist at the U.S. Department of Veteran Affairs, and her major clinical and research interests are substance abuse, trauma, and their comorbidity. She is also the author of the Seeking Safety Treatment Manual. She addresses this industry misconception in the following way. Addiction treatment historically has not addressed trauma. Clients have been typically told to get clean and sober first, with trauma viewed as too distressing a topic. The origins of Seeking Safety began with a paid research grant from the National Institute on Drug Abuse over a 10-year period in the 1990s. There have been over 20 studies conducted, one of which consisted of 176 clients with community clinicians and published by the Journal of Substance Abuse Treatment, which concluded that this model was not only effective in the treatment of substance addiction, but in conjunction with trauma. With that said, it's important to note that cognitive behavior theory is the theoretical basis for this treatment model. What are the key principles of Seeking Safety? Now that we understand its origins and basic overview, it is important to also address its key principles. Seeking Safety is based on 5 central ideas. Let's go over those together. 1. Safety is the priority of the first stage of treatment. 2. Integration of substance addiction and trauma-based treatment, which we've learned in previous slides, is not so common, and the industry's common misconception that you cannot address both substance addiction and trauma at the same time, as it may be too intensive for the patient. 3. Focus on ideals. Many people, when they see number 3, often confuse us with what is best for the patient based on the clinical opinion of the professional. This is not what number 3's focus is actually about. Number 3 is actually the focus of the patient's ideals. For example, the patient may be asking themselves at this point in their life, what is the meaning of life? They may be searching for meaning because their drugs or their alcohol addiction or their trauma has robbed them of any previous notion or previous dreams they would have had for their own life prior to that. Number 3 is about getting back to the patient's ideals or figuring out where they are currently as a result of their trauma and substance addiction. Number 4, to explore the 4 content areas such as cognitive, behavioral, interpersonal, and case management. What this would look like is, how does the patient feel? What are they telling themselves? How does what they're saying to themselves affect their behaviors? And how does their behaviors affect their relationships and interactions with others? And of course, case management would be the integration of all of these things into the treatment planning process. Number 5, attention to the clinician or therapist process. Now would be a good time to pause for discussion with your on-site presenter to discuss examples of patient ideals, content areas such as cognitive, behavioral, interpersonal, and case management, and how that directly relates to Sovereign and your own personal or professional application in the therapy and clinical process. Looking forward to hearing your discussions. Why does Seeking Safety work? Let's begin with a thought-provoking quote by Dr. Nahavitz. Because Seeking Safety does not require the client to explore painful trauma narratives, it can be conducted with the broadest range of clients, including the highly complex, chronic, and multiply burden clients who often cycle in and out of treatments. So let's go ahead and start with the first bullet. Using the stages of healing as a reference, i.e. with stage 1 being safety, Stage 2 being mourning, and Stage 3 being reconnection. Seeking Safety does a very good job of focusing primarily and only on Stage 1. Stage 1, safety, is a huge therapeutic task for patients and clinicians alike, further proving the need for a treatment approach that solely addresses the stage, which Seeking Safety does. Second, treatment integration of trauma and substance addiction by treating both areas of concern at the same time with the same clinician. I have actually worked at many different treatment facilities, and I have to say that oftentimes certain aspects of treatment was addressed by different professionals. I have seen where mental health issues were addressed by a mental health clinician, which makes sense. But the substance addiction, although could be addressed by the mental health clinician, was uniquely and separately addressed by perhaps an alcohol or drug counselor. Seeking Safety actually aims to combine that into one person. It doesn't mean that they can't have secondary treatment or secondary assistance by additional case managers and counselors. It just means primarily it would be funneled through one solitary person, a clinician. Additionally, Seeking Safety works on a restoration of personal ideas, as discussed in the last slide, that the patient has lost during the course of their trauma and addiction. If the restoration of the personal ideals are healthy, then this would be something that would be integrated into the treatment model. If it is not, then the therapist would have to work closely with the patient to weed that out in a productive and healthy manner. Seeking Safety allows for either. Additionally, understanding how the patient's cognitive distortions and themes and how that has impacted the patient behaviorally, interaction with others, and how to collectively manage and plan the treatment accordingly is paramount and should be considered within their goals and objectives to find ways to integrate that within their treatment plan throughout the duration of the Seeking Safety model. Allow me to share with you the Seeking Safety treatment topic example. This may be very helpful to some of you later on when a group activity is presented to the team. First of all, the screen that you're looking at actually addresses 4 separate treatment topics. As I had indicated, there are actually 25. And within one topic addresses over 80 safe coping skills. Seeking Safety treatment topics include the following domains: cognitive, behavioral, interpersonal, or a combination thereof, and are listed within the parentheses. Number 1, Introduction to Treatment and Case Management. That would be an example of a Seeking Safety treatment topic. Within that topic, you would see things like introduction to treatment and getting to know the patient, assessment of the case management needs. If you look at number 4, for example, you would see an example of detaching from emotional pain. You would see grounding or behavioral there. When I was visiting and shadowing for training the sister site here at Sovereign Health known as Chandler, I was impressed by their grounding strategies. They would actually hand the patients bags that they would assemble themselves. The patients would assemble themselves, and inside these bags, should the patients be experiencing a trigger or a moment of crisis, they would reach for that bag, and inside there would be items that would activate the patient's 5 senses. So, for example, there would be something in there that was fuzzy, that they could rub between their fingers, that would activate their sense of touch, and then they would have something that smelled good, which would activate their sense of smell, and there might even be like a little mint, and it would activate their sense of taste. The great part about that is that it helped to distract the patients and reorient them when they were experiencing an emotional crisis. Number 4 is just one of many Seeking Safety treatment topics that this curriculum offers out of 25. Now that we understand the basic overview and origins, industry challenges, its many benefits, proven research reliability, key principles, and how it works, it is equally important to address how Seeking Safety will apply to you as a clinician. The processes and features of treatment are seen on your screen. However, I did want to share with you what Dr. Nahavitz specifically stated on this matter. With this dual diagnosis population, who are often considered difficult, it is a challenge to provide effective therapy. Clinician processes emphasized within seeking safety include compassion for the patient's experience, using coping skills in one's own life, giving the patient control whenever possible to counteract the loss of control inherent both in trauma and substance abuse, meeting the patient more than halfway, doing anything possible within professional bounds to help the patient get better, and obtaining feedback about how the patients view treatment. There is a balance of praise and accountability. The opposite of such positive therapist processes are negative processes, such as harsh confrontation, sadism, difficulty holding the patients accountable due to misguided sympathy, and becoming a victim to the patient's abusiveness and power struggles. End quote. With that being said, it is very easy to understand why incorporation of praise and accountability is very vital in avoiding countertransference and harsh words with the patients. We need to make sure that we're focusing on their potential rather than their pathology. Furthermore, in this process, so that we don't isolate them from us or make them feel unsafe, we need to be sure to use simple language rather than using psychotherapeutic lingo when speaking to them. We can also do that while keeping it interesting. Just find ways to relate the material that we're offering to these patients. Find a way to offer that in a way that is relatable into their own lives, keeping substance abuse as a priority within treatment. While we are addressing the clinician's role in the seeking safety process, it is equally important to point out what this does not address. There are two main omissions. One, exploring past trauma, and two, psychodynamic interpretive methods. Allow me to share with you an excerpt from the Seeking Safety Manual. There are several reasons why exploration of trauma memories is not part of seeking safety. Primarily, it is not yet known whether it is safe and effective for patients who are actively abusing substances. Numerous experts have recommended that for substance abusers, such work cannot begin until they have achieved a period of stable abstinence and functionality. The concern is that if patients are overwhelmed by painful memories from the past, their substance use could worsen in a misguided attempt to cope. Moreover, seeking safety was initially tested in a time-limited group format, which did not appear to be an appropriate context in which to conduct exposure methods for victims of repeated early trauma, who represent a large number of patients with this dual diagnosis. With that being said, it is paramount that we as clinicians stick to these two main omissions when treating patients. Here we have additional treatment resources that are often proven helpful for the treatment of trauma. Keep in mind some of these would be your long-term treatment options and should be carefully considered when integrated into seeking safety. Please use clinical discretion while being mindful of the seeking safety omissions discussed on the previous slide. The following treatments are relevant for the treatment of trauma, and substance abuse and the relativity of the content should be considered. Cognitive behavior therapy, dialectical behavior therapy, exposure therapy for PTSD, motivational enhancement therapy, and 12-step treatment. If I use more, I stop feeling. The drugs, yeah, they numb that excruciating pain I feel daily. Talking hurts too much. It makes me feel crazy. Can't win, so I use. Consider, if you will, clinicians, the desperation heard within that patient's voice. The patients that seeking safety targets are those who live with this paradox between wanting to understand why it happened, but they don't want to have to endure the pain to discuss it. This is why seeking safety is so important. Colleagues, this is a group activity. I am confident that most of you are familiar with vignettes. For those who are not familiar with vignettes, vignettes are limited. They do not contain a living, breathing person to incite inquiry or to seek for more information. The purpose of this vignette is very simple. It's to help you familiarize yourself with how seeking safety can be used flexibly and with any level of care and any substance and level of trauma. Let's actually have some fun and do this as a team. Presenter, please click pause now. The therapist's perspective. I will share with you some experiences as portrayed by Dr. Nahavitz in her book titled Seeking Safety, a treatment manual for PTSD and substance abuse, in regards to what many mental health treatment professionals have said in regards to this patient population. In fact, one social worker said, "I used to feel that I wouldn't go near substance abuse patients with a 10-foot pole. I wouldn't treat them and was pretty judgmental of them. Mostly, I didn't understand them. But when I became aware that many have a history of trauma, well, I began to feel more compassionate. I realized how often they are self-medicating their pain." Additionally, a psychiatrist on the substance abuse unit of a hospital said, "Where I work, patients are told to get off substances first. Only once they are clean can they deal with the trauma. They get 4 substance abuse groups a day, but no groups for PTSD. Some of them feel invalidated, as though their trauma doesn't even matter." Clinicians may feel confusion over how to treat patients. For example, should the patient talk about painful trauma memories during treatment? Do I insist the patient must become substance-free before we work on the PTSD? How can I contain a patient who becomes overwhelmed by PTSD symptoms? Should I discontinue treatment if the patient keeps using substances? Does psychotherapy for this population even work? And should I just insist that the patient go to Alcoholics Anonymous? Bottom line, Seeking Safety offers a safe place of its own for clinicians to bridge the paradoxical gap, and I'm excited that I've had the privilege of introducing you to it. In conclusion, dual diagnosis of PTSD and substance abuse is very common and is reflected by the rate of 12 to 34% among patients seeking treatment, and alarmingly 30 to 50% among women. Seeking Safety provides an evidence-based model to properly address the unique needs of those who are suffering from trauma and substance addiction at the same time. I want to thank you for the opportunity to get to serve you in this way. Feel free to reach out if you should have any questions, comments, or concerns, and I will happily help you in any way that I can. Have yourself a wonderful day, and welcome to Seeking Safety.